but how do we continue to modernize the infrastructure, the technology that is part of healthcare so that we can do the sorts of things that we take for granted in other industries? We know where many of the packages that may be headed to our home, where they are right now. But yet, we still often have to reach out to our healthcare provider to engage and make an appointment.
That was John Supra, Chief Data Officer at Prisma Health, describing the way he thinks about technological innovation in healthcare. You're listening to How I Transform This, presented by Virsys 12. Virsys 12 is the award-winning Salesforce Gold consulting partner focused on healthcare innovation nationwide. In this episode, John explains why he's prioritized cloud-based technology in his healthcare transformation work. He also offers advice to other leaders who are looking to implement large-scale change, and explains how the COVID-19 pandemic has inspired new innovation.
I hope that some of the things that we learn, the what-ifs, what is possible, is we use this opportunity to move forward this engagement in our health so that we redefine healthcare not as something that happens once in a while, but something that we're thinking about, talking about, and are supporting our communities each and every day.
I'm your host, Clark Buckner, and along with Virsys 12 founder and CEO Tammy Hawes, each episode we're seeking out healthcare technology industry leaders exploring stories of success through the transformation of healthcare. For more stories like this, be sure to visit Virsys12.com/podcast. Now, let's jump in.
This is John Supra. I'm the Chief Data Officer at Prisma Health. I've been with Prisma Health for over 6 years, where I've worked on both our data and analytics strategy, and I've been a leader in our Care Coordination Institute.
Wonderful. Thank you so much for joining us on How I Transform This.
Yes, thank you, John. This is a real treat for me today. I've known you and your good work at Prisma and CCI for almost 6 years now. So maybe I met you pretty early on after you'd started there, and I see you as really one of the most transformational leaders that I've met, and so excited to talk to you today. So thank you so much.
Thank you, Tammy. And yes, we met, I believe, very shortly after I joined, as the team was already engaged with you and your team to look at how Salesforce could transform some of our work. And I think you and I had met in those first weeks or months as we started working together.
Yes, I think so.
You know, John, what's cool about this to me, so you and Tammy, you already know each other. I get the chance to meet you today and hear all the great things about you. And for Tammy to say you're one of the most transformational leaders in healthcare, that's a big deal. So I'm ready to buckle up and enjoy the ride on what we've got up ahead. So first, could you catch me up to just a snapshot of your time in healthcare? And then we'll talk a little about what's been going on in healthcare today, and especially today, because there's been a lot happening. Tell me a little about just a snapshot of you and your background.
Yeah, so thank you. And thank you for those kind words around transformation. And I actually didn't start my career in healthcare. Many people in healthcare, I've found, spend a good part of their career. I'm an engineer by training, have actually worked in a number of industries. And in some ways, I would say was very fortunate to join healthcare by seeing somebody that I knew from Southern California, as I was actually living here in South Carolina and traveling back and forth between South Carolina, an office in Los Angeles, an office in New York. And he had been here for some time and knew I worked on software development, and asked me if I'd be interested to talk to him and them about a project they were doing for the state's Department of Health and Human Services. Well, I thought that sounded like a great opportunity, and I think it's always amazing to talk to old friends and connect about work they're doing and how you might be able to help. And the next thing I knew, I was part of the state's Department of Health and Human Services, leading activities around technology transformation in the claims and eligibility systems. But I think more importantly, starting to intersect technology as one piece of transformation, but really, how do you think about the culture as well as the processes or operations when you want to drive transformation? And I was fortunate to work at the state's Medicaid agency, learn about healthcare. We were able to transform or change some of the systems, but I think bring along some culture, some process change that had enabled our state's Medicaid agency to grow stronger at a time going through the changes associated with the Affordable Care Act. And from there, met the team at what was the Greenville Health System at the time, and joined what is the Care Coordination Institute, where we've been focused on value-based transformation, provider systems, accountable care organizations taking risk, and really focused on the data and analytics required to succeed in value or risk-based transformation, along with the quality, and then working closely with our clinical colleagues, our physicians, nurse, clinical leaders to transform care management, programs, connect across the continuum, and really drive outcomes for the patients and communities that we serve. And that's how I really first met Tammy, where we were working on implementing Salesforce as part of that transformation.
I know Tammy's going to have something to jump into in just a second, but I just want to call out those three phrases, and I would love to talk more about those in just a moment. But technology, culture, and process change. Those are the three big things I just heard you share that I think would be really interesting to talk about here in a few minutes.
So, John, when we met, you didn't have necessarily a blank slate. There were some processes and some systems that were in place with CCI as you guys were building out the technology to support the health system and the new ACO. But you were very early on. I mean, 6 years ago, there was some adoption of cloud technology, but there was still a little bit of reservation in healthcare about that. Tell us a little bit about how you kind of went through that process where you were trying to build from the ground up transformational technology to support the organization.
Yeah, I think your comments 6 years ago, and I think to a much lesser extent today, cloud technology has really come late to healthcare. For me, I was fortunate prior to joining the state's Department of Health and Human Services, I was working in digital photography. In that area, we were working on how to transform the process of making selections for covers of magazines, for billboards. And the team we had taken what was a very manual process. If everyone paid, you may remember rush charges in photography. If everyone paid rush charges and messengered them across town, across the country, across the world, that process of selecting images was usually still several days, maybe a week at the fastest. So we looked at a process to make that transformation of what could you do digitally for images that many of them were just starting to be shot digitally. And we drove that change. And as I was leaving that organization, coming into healthcare, we were moving our operations out of a hosted data center into Amazon's web services. And that was 10, 12 years ago. So I had that experience where I'd already worked closely in the cloud environment. When I joined Prisma Health, the Care Coordination Institute, and looked at what types of services do we need to be nimble enough to grow quickly, to drive, and I really believe that process and cultural change have to be part of your technology transformation, we needed to manage a network of providers that were across our region. We needed to find tools that said the processes would allow us to make quick updates, to distribute some of those updates out to, call it the front lines, in areas where healthcare hadn't engaged either Salesforce, CRM, other cloud technologies. But my experiences said those are the directions we need to go. If we want change in how we deliver care, how we operate, we want to leverage some of the efficiencies of cloud-based technologies. I knew from my previous experience that we had to be willing to explore them. And I think we were very fortunate to build an infrastructure. As I mentioned, we've recently moved to Snowflake and another cloud-based data technology. And we have continued through this journey to look to the cloud in that transformation towards cloud-based technologies is an important part of driving both technical but also process change in healthcare and allow us to think about how we bring our culture around to be comfortable.
So, John, you and the organization were one of our first customers on V12 ACO, that platform that sits on Salesforce for accountable care organizations. And we've recently rebranded that V12 network because it's really just network management, no matter what kind of organization you are. But the technology is part of the solution. You've actually talked a little bit about your tech stack where you have Salesforce, you have our app, you have Snowflake, obviously you have EMR systems. That's a very complex setup, like any health system is. What's your tips? What's your secret sauce for rallying all the troops and some would say herding the cats?
I don't know if there's any secret sauce. As Clark touched on, I do think finding that balance. How do we look to improve or change process? And we need to do it not for process sake, but for what are the goals or the outcomes? So how can this approach fundamentally shift the work that our team members, our providers, our clinicians, our patients can do? And it changes the processes or engagement. And as we look through what we've seen over the last year for the challenges that COVID and the pandemic have really put on our communities, our nation, the world, and our healthcare providers, we've needed to change processes and probably do it more quickly than we were expecting. The first area that I don't know if it falls under secret sauce as much as one important piece of the puzzle is looking towards the processes you want to change. I talked a little bit about my experience in digital professional photography prior to coming into healthcare. We wanted to change a process that required lots of paper, humans moving things around, and bring it digitally. In our building our networks, we wanted to make them as efficient as possible. So we were able to implement a technology driven by the processes of rapid change. During COVID, a lot of the experiences of digital health or telehealth that healthcare has been testing, piloting, became critical to the success of patient care through this last year. So how do we let the process and that need drive transformation? How do we bring alongside it technology, not for technology's sake, but for the purposes of accelerating that change or process? And how do we always remember that technology isn't replacing the work that people are doing? It's augmenting, accelerating, shifting, or freeing people up to do work that technology, systems can do more reliably, and realize and recognize culturally that the work to be done now is a little different, and that we're able to bring those three ideas together to actually drive change. So if there's a secret sauce, if we use that language, it's about recognizing the transformation is hard work, but we've got to be open to it if we want to see the results of a different future. I was listening recently, and you may be familiar with the Masters of Scale podcast, and Branson was on it, and he asked the question or challenged the what if and why not? What if the world was a little different? What if we did this? And why not, or why shouldn't we give it a shot? So I think that culture is one in which my engineering background, coming out of some other software development and coming into healthcare, has allowed me to think about those questions. And I thought they were just 4 simple words put together really beautifully there that I think suggest, what if it was different? Why shouldn't it be, or why not? And how do we build that into how we think about change every day?
John, when you look back at, well, basically a year ago, and all the things that have changed and the change that has been forced upon the health system, What are some of the things that surprise you about things that you implemented that you a year ago would have never thought you would have implemented this quickly?
I really, Tammy, want to pick up on your last word of this quickly. So as you started there, the idea of surprise that we implemented, I think many of the things that health systems throughout the country and really throughout the world implemented are things that had been experimented with, piloted, tested. But that inertia for cultural change, process change, was sort of holding us back. I touched on, and I think it's a really important example, both within our health system, the growth in telehealth, the reality that there was an awful lot of patient care that we could deliver virtually. And we could also figure out that some of this work needs to be done in person, or care needs to be done in person. So how do you look to build some hybrid support electronically with some minimal and safe in-person activities? I think more than anything, all of that piloting, all of that thinking, the testing, and all of that, well, we really can't do that, or it can't do it that way. Those sort of floodgates broke open, and an awful lot of really good care was delivered through this last year. And then I think pivoting a little bit to some of the things that I had been working on. As you mentioned, one of the complexities in healthcare is bringing together clinical records across multiple organizations when you form a accountable care organization, an ACO, or a clinically integrated network, ensuring that you have quality metrics across the network. So a lot of the work that we had done provided that framework that we could then accelerate through. So during this same time, as I had mentioned, we made the move off of more traditional databasing to Snowflake and some cloud databasing. We took our experiences in bringing multiple EMRs together, that we were able to very quickly build a COVID-19 dashboard across our system. So at the time, all of our hospitals, all of them were not on the same EMR. So we were able to combine and look at our patient care across the entire system. We knew we needed to get into the community and do testing. We were able to combine some of our visualization work with that data we were starting to collect, and able to identify communities where we might have been seeing patients coming in from, but we weren't doing much testing, or we weren't aware of what the prevalence of the disease was. So we were able to do community-based testing. Those same skills proved valuable as we moved into the vaccine stage. So we were able to start vaccinating within our healthcare worker community, expanded and grew to some large sites, and then also looked at where were people in our communities not getting vaccinated, and reach out and engage with those local leaders and identify social vulnerability, areas where we know that we have had high prevalence of the disease, and look at where would it be best to take our community-based vaccines as well. So I think a lot of what I would say over this last year is an amazingly resilient community healthcare workforce, that we were able or free to let some of this technology challenge our processes, react to what we were seeing each day, each week. And I think one of the biggest things, and I think you've probably heard this from others, is we've learned a lot about what is possible, and say, what if we are facing a pandemic? How do we respond? And how do we learn from that day after day? And really just proud to be part of the Prisma Health team and the team that has met the needs of the communities in South Carolina.
So, Johnny, you just said we've learned a lot about what is possible, and how do we respond, and how are we learning about the day-to-day, and there's so many changes. And something we've talked often about on this podcast, this is way before COVID and since, is patient engagement. Again, kind of on that theme you said of what if, why not. We understand that Prisma Health, you guys are over there making big things happen in South Carolina. So I'm curious about how you've seen patient engagement change so much, and are really interested to hear where it's going in the future.
Well, thank you. We're just privileged to serve our communities. I think that notion of patient engagement, and I probably want to expand it a little bit to maybe think about engagement about our health and well-being. During COVID, clearly people were concerned about their health, wanted to know, learn about COVID. We were able to connect with them in some ways that we knew were possible because we connect with a lot of other things that we do for work, for pleasure, for transactions digitally. And there's an awful lot that the engagement of a digital experience for my health and well-being, tied with being connected with a provider community, probably tied with what we've been learning from our journey down value-based care, where engagement with a care management team, navigators to help us understand our need, health coaches, and even sometimes virtual coaches to help us be engaged with our own health and well-being. And I think the challenge to health systems or large delivery systems or integrated health systems are, how do you find the balance of providing outstanding health services or clinical care? How do you be a trusted voice through a pandemic like COVID? And how do you engage much more frequently? We often think about going to the doctor or having a doctor visit as an infrequent experience. But how do we shift and think about engaging with our health in a very different way? So I hope that some of the things that we learn, the what ifs, what is possible, is we use this opportunity to move forward this engagement in our health and well-being, personally, of our families, and that we think about how the shift towards value-based care shifts the thinking about delivering outstanding healthcare services while we're engaged with patients virtually, in person, as we can safely throughout our communities, so that we redefine healthcare not as something that happens once in a while, but something that we're thinking about, talking about, and are supporting our communities each and every day.
John, that's fantastic. If you had a magic wand and you could change one thing in healthcare, what would that magic thing be?
I think we have to start at how healthcare and what's included in healthcare services is paid for in this country. A lot of the challenges that we have when we think about value-based care, Prisma Health and the healthcare providers are still generally paid for the services we deliver. And we need to deliver the services that are necessary. But if we think differently about how healthcare is paid for, we can really drive what is included in better health. And that is the aspiration of value-based care. It's what I think when federally at the state level, employers are asking, how do I create better health? And instead of buying healthcare services, but buying or purchasing health, we can have a different future. And that's a pretty big magic wand or a flip of the coin. But I think it's important for both those that provide healthcare services today and those that are either the buyers or paying for healthcare to be thinking a lot about the limitations of some of our current models and what we could do differently. What does a world look like where we recognize the importance of the social determinants of health in investing in healthy food, healthy eating, better transportation, healthier housing for those people that have those needs, and how much they impact health care and the outcomes in a community. So I think we need to think hard about what and how we fund healthcare services and make that shift to funding health.
Yes, that's a big ask, but that would be great. And, it's more about health and wellness than being reactive to the disease, but preventing a disease ahead of time. And then also, mental health too. We're seeing that that's playing a huge part in physical health.
Absolutely. And that was an area within the Prisma Health system where behavioral health professionals are a limited supply. And by moving virtually, we've actually been able to expand access. I think our team has delivered over the last year at least a third more and maybe almost 150% more visits with a similar amount of providers. And that's really been, I think, a benefit to our community.
Yeah, that's fantastic.
That is encouraging when you can see some good.
So it's been challenging, there's no doubt. What have we learned, I think, should be an important question. And it really has, and to carry that theme we've talked about, it really has been a, what if we have to change quickly? What would we do? And what have we done? And again, as I said earlier, just really proud of the Prisma Health team to responding, to being open to learning every single day, and in supporting our work in transformation. And I think one of the other questions you had asked or we had touched on how does this set the stage for some of the work that we want to do? Connecting back to one of the early questions about how did I get into healthcare and what have I seen a little differently? Well, a lot of technology delivers a really short message, a service-based environment where that short message alerts a provider, a care navigator, a health coach to say, it would be great if you reached out to this patient because we've got some signals and all of this data that's floating around that says, they could use a little support. And I think that's a really interesting aspect of what a shift in patient engagement might look like. And on the technology side, not just the move to the cloud as we've talked about, but how do we continue to modernize the infrastructure, the technology that is part of healthcare so that we can do the sorts of things that we take for granted in other industries. We know where many of the packages that may be headed to our home, where they are right now. But yet, we still often have to reach out to our healthcare provider to engage and make an appointment. How do we take some of those signals? How do we engage appropriately? And how do we use them to continue to improve the health of those that we serve?
Yes, that's fantastic. And I think that most consumers, patients, and even physicians as well, they are looking for that Amazon-like experience with healthcare. And although it can't be exactly the same as an Amazon experience because it's a little more complicated, there are definitely some steps that we can all take. We're really excited to hear about all the things that Prisma is doing and being a leader in the healthcare industry. So thank you for that.
Great. Well, thank you for the opportunity to speak with you. And I really appreciate sharing some reflections about the work that we're doing at Prisma Health, our value-based journey within our Care Coordination Institute, and how together we shift culture, we deliver better health, we challenge the processes, how we've done things, and when appropriate and where appropriate, we accelerate that work with technology. I really think it's so important to think about those together and really appreciate the conversation and the opportunity to share what we've been doing in South Carolina.
Yes, it's been excellent. Thank you so much for the time, John.
Thank you. We appreciate it.
Thank you both.
Thanks for listening to How I Transformed This, Success Stories of Transformation in Healthcare, presented by Virsys 12. To learn more about how Virsys 12 is best situated to transform the healthcare industry and to follow along with this show, be sure to visit Virsys12.com/podcast. We'll see you next time. Best situated to transform the healthcare industry and to follow along with this show, be sure to visit Virsys12.com/podcast. We'll see you next time.